Hey, San Diego. This is Dr. Shumard with Integrative Wellness Center of San Diego. And today, what I want to do is I want to continue our conversation from last week in regards to diabetes and your adrenal gland. So, if you did not watch that video last week, make sure after you watch this one, go back. You're not going to be off at all if you watch this one first, but go back and watch that one as well. I think you'll really enjoy it. Just to kind of give you a feedback, or not feedback, but a recap of what we spoke about last time. The first part of the adrenal gland and how its involvement in regards to stress, and how most of us are dealing with some sort of stress. Some of us are dealing with more stress than others, but we're all under some sort of stress on a regular basis. And also how the adrenal gland can impact it's the brain, and the brain is heavily involved, the adrenal gland is heavily involved in how the brain functions. So it's an important thing to really understand. And so I don't want to go too much into that because I want to spend as much time as possible on a few other things that are important in regards to the adrenal gland. So one of those things is sleep. You may or may not know this, but your sleep patterns can be disrupted from adrenal function. If the adrenal gland is working properly, then you're going to have better quality of sleep. And one of those reasons is because cortisol production, which is what we spoke about last time. And if you don't know what that is, please watch that other video. But cortisol production from the adrenal gland, the major hormone by the adrenal gland, can impact the way the brain functions, which can impact the way you sleep. So many times, I talk to patients and they're unable to sleep or get to sleep at night, and also they're not able to stay asleep. And that oftentimes is due to cortisol production by the adrenal gland trying to stabilize your blood sugars. And so, when we eat dinner, for example, let's say you eat dinner at, say, 7 p.m., about 3 hours later, by 10 p.m., all the sugar from that food that was converted to sugar is gone. So your body still has to produce or have sugar for the brain to function, your organs, your tissues. So the liver, the pancreas, and the adrenal gland are all kind of intertwined there and helping you to support that blood sugar while you're sleeping. And oftentimes those cortisol spikes can be pretty high, which can impact your brain and wake you up. And you may think it's because you have to go to the bathroom, but in many situations it's because the cortisol levels are spiking the response inside your brain, because it is a stimulant to your brain, and so you'll wake up. And then other times we'll have patients telling me that I can't go to sleep. I just lay down and my brain is just spinning and thinking about the day and I can't shut it off. And maybe you've experienced that. That's also a component of your cortisol levels being spiked or elevated at a certain time, which is at night, which is definitely going to impact the way your ability to sleep. So if you're having sleep issues right now and you have diabetes, which many of you have, it's more than likely due to an adrenal dysfunction. So that would require your adrenal gland to be analyzed by a practitioner like myself. Usually when you get an analysis done, if ever, by your healthcare provider, they're just not going to run the right tests. They're not going to analyze you appropriately. And so you're not going to get the full impact of what's really going on with the adrenal gland. So sleep can definitely be a component to this issue in regards to your adrenal gland and how the adrenal gland is actually functioning. So if you're in a situation right now where you're popping melatonin like crazy and trying to do all these things to help with your sleep, it very well could be an adrenal issue. Or worst case scenario, taking a pharmaceutical drug to help you sleep, because those can have negative impacts on your body, and it may just be an adrenal dysfunction, and you can get that fixed. The second thing is that I want to discuss about in regards to the adrenal gland is the hormonal situation. Now let's talk about two different situations that could be going on here, because we have male hormones and we have female hormones. Now, what you may or may not know is that both male and female have male and female hormones. So a female will have testosterone, a male will have estrogens. Those levels will obviously be different inside each one of us, but they're still there, and they're definitely going to make an impact on your body. Now, your adrenal gland has a component to stabilizing or managing your hormones. Now, as a male, we can still produce hormones through our reproductive system for our entire life, right? That's one of the reasons why as males, we can still have children at an older age, but females can't, because their reproductive organs stop producing those hormones. But the adrenal gland has a role in regulation of these hormones as well, which is very important in regards to diabetes, because hormone disruption, elevated or depressed, can cause insulin resistance or increase the risk of insulin resistance. So looking at the hormones is also another important factor that should be done in your evaluation process. And if you're just looking at blood through hormones, well, that may not be the best way. It is one way, but it may not be the best way to analyze hormones. There's other types of testing that is much more specific and will give us the right type of data to know what your hormones are doing, how they're functioning, and how they're impacting your insulin resistance and diabetic condition. But we know that the adrenal gland is involved in this process. So, for example, with a female, there's a certain time in their life where they stop producing hormones through their reproductive system. It's called menopause, right? And so that's a process that all women should go through. Now, what most women may not realize is that menopause should just be a transition, right? It should just be no issues. There shouldn't be any symptoms. There shouldn't be any problems. Maybe a few things here and there, but they should just move into that phase of their life. But most women don't have that scenario. Most of them are going to have hormonal shifts, maybe hot flashes, irritability. These things are going to happen with their situation. And they go and see a healthcare practitioner. And what do? They give them hormones, right, to try to stabilize that situation. It may not be the best option, but that's what they're doing. Many of them are not having their adrenal gland analyzed. And I would tell you, from my perspective, most of the women that I evaluate, most of them who are having these hormonal issues, meaning symptoms, have as their underlying problem their adrenal situation. The adrenal gland is not functioning optimally, which is also contributing to their diabetic condition.